Hello, Congressional Committee. My name is Shane Mall. The Health System Efficiency Indicator on the National Scorecard on U.S. health system performance remains at an all-time low with a score of 53 out of 100. The efficiency indicators are scored based on a multitude of areas that can be improved upon. The efficiency indicators are based on the following areas: potentially wasteful or duplicated medical testing related to the unavailability of results or records at doctor's appointments, or inappropriate imaging for lower back pain. Other efficiency indicators include inappropriate utilization of emergency departments, preventable hospitalizations for issues that can be done in the ambulatory setting, Medicare readmission rates within 30 days, Medicare costs for care and mortality in regards to heart attacks, hip fractures, colon cancer, and chronic diseases. Another efficiency indicator is health insurance administration as a percentage of the total national health spending and the use of electronic medical records in primary care in hospitals. Efficiency and access to health care are related in so many ways. A patient's access to receive patient-centered, timely, coordinated care is an issue that is deteriorating and needing improvement. For example, only 43% of surveyed adults that had health problems were able to schedule an appointment to see a doctor when they were sick. This leads to patients ending up in the ER for a condition that can be treated by a physician in the ambulatory setting. The lack of access to a primary care provider after office hours also leads to patients being treated in the emergency departments. The lack of care coordination between multidisciplines, ERs, and primary care providers causes testing to be duplicated and wastes our limited resources. 19% of sicker adults in the U.S. reported that their doctor ordered a test that had already been completed in the last 2 years. An improvement that has been made to improve access to health care in America was the implementation of the Affordable Care Act. The goal of the Affordable Care Act, signed into law in 2010, was to improve accessibility to quality health care by providing access to affordable health insurance. The Affordable Care Act is a comprehensive program providing patients a sort of protection on taxes and regulations within the healthcare system. By 2019, health insurance will be made affordable for 25 million more Americans, giving them an opportunity to receive higher quality care. According to the Health Resources and Services Administration, the primary care provider shortage is of real concern. The primary care provider demand is driven by the aging population and the increase in insured Americans made affordable by the Affordable Care Act. Basically, the demand for primary care providers exceeds the current supply, creating a shortage. The Health Resources and Services Administration estimates the number of primary care physicians is projected to increase from 205,000 in 2010 to 220,000 in 2020, which is an 8% increase. But the total demand for primary care physicians is projected to grow by 28,700 from 212,500 in 2010 to 241,000 in 2020, which is a 14% increase. A quality indicator on how well Americans have access to health care in comparison to other countries is benchmarking. And that's what we've been doing here. Benchmarking is measuring results compared to the highest and best performers' results, so the other countries. Local health policies can be implemented to improve access to quality health care. Local policies will require key stakeholders to put them into action. The key stakeholders will include hospitals, primary care providers, nurses, social workers, and health insurance companies. By taking the STAR approach of stopping and reviewing the issue, thinking critically about the data, acting by formulating options to the policy, and reviewing each policy option before choosing the policy with the data to support it. What I am requesting from Congress today is the implementation of a telehealth program to be implemented by the local hospitals' ambulatory primary care practices. Telemedicine or telehealth involves remote diagnosis and treatment of patients by medical experts who are local, the next city over, or another continent away. It is estimated that 84% of Americans have a computer and 73% have access to a broadband internet connection. This is a great benefit for our rural communities where they can be 20 plus miles away, and for those who cannot or are unable to use public transportation. Telehealth can save money, improve access, while providing quality care for patients who might not otherwise have access to specialists or basic primary care. Thank you.